Coronaviruses, a family of viruses that commonly occur in humans and animals, are named for the crown-like spikes on their surface that can be seen under a microscope. Of the 7 known strains of the coronavirus, 4 are common human coronaviruses. Typically, these cause mild to moderate upper respiratory tract illnesses similar to the common cold and flu, and sometimes lower respiratory tract illnesses such as pneumonia or bronchitis. Most people will experience a type of common human coronavirus in their lifetime. 3 new strains, called novel coronaviruses, are mutations that occur when the virus is transferred from animals to humans. Previous novel coronavirus outbreaks include a global outbreak of severe acute respiratory syndrome, or SARS, which resulted in 8,096 cases and 774 deaths from 2003 to 2004. More recently, the Middle East Respiratory Syndrome, or MERS outbreak, began with transmission from dromedary camels to humans and affected the Arabian Peninsula in 2012. Coronavirus disease 2019, referred to as COVID-19, is the latest outbreak. It's caused by the human body's reaction to a new strain of coronavirus known as SARS-CoV-2. SARS-CoV-2 evolved from an animal-to-person transmission to a person-to-person transmission and was first detected in Wuhan, China. Early on, many of the patients in the outbreak reportedly had some link to a specific food and exotic meat market. Currently, there is much that is unknown about the transmissibility of this virus. Since its initial detection, the virus has now spread worldwide. The World Health Organization, WHO, universities, government agencies, and businesses around the world are researching COVID-19 with new information discovered daily. The risk of infection is dependent on a person's exposure. Healthcare workers caring for infected patients and family members in close contact with a patient are at higher risk for infection. Others who may have been in close contact with an infected person are also at risk. At this time, the most accurate and reliable sources of information about COVID-19 are from the WHO and public health agencies in your country. Some viruses, such as measles, are highly contagious, while others are less so. Because COVID-19 has only recently been identified, its transmission modes are still being evaluated. It's thought to spread mainly from person to person, between people in close contact, within 1 meter, 3 feet, through respiratory droplets produced primarily when an infected person coughs or sneezes, or possibly when they speak or breathe. These droplets can enter the mouths, noses, or eyes of people who are nearby. People are thought to be most contagious when they are most symptomatic, the sickest. However, infected individuals can spread the virus to others, whether displaying symptoms or not. Additionally, spread of the disease may be possible through contact with a contaminated surface or object on which the virus may persist, then touching your eyes, nose, or mouth. Community spread refers to the spread of an illness within a community, where people who have unknowingly been in contact with an infected person or persons later develop symptoms of the disease. This is because people exposed to COVID-19 may become carriers before they become symptomatic. Travelers returning from affected locations with community spread are also at elevated risk of exposure. If you have close contact with someone with COVID-19, you may be asked to stay home to self-monitor and avoid contact with others for up to 14 days. The WHO declared COVID-19 a pandemic on March 11, 2020. There are elevated risks associated with travel, close contact activities, and caring for symptomatic patients. Confirmed COVID-19 infections have ranged from asymptomatic to few symptoms to severe illness and death. Symptoms can include fever, tiredness, cough, shortness of breath, aches and pains, sore throat, or pneumonia, making it difficult to distinguish this disease from influenza, especially early on. Fewer people are also reporting diarrhea, nausea, or a runny nose. Symptoms of COVID-19 may appear in as few as 2 days or up to 14 days after exposure. There is currently no vaccine for the COVID-19 infection. Several immunizations are under development but may not be available until 2021. Numerous drugs are being trialed for use in severe COVID-19 cases. Check the WHO website for the latest status. The best protection is to avoid being exposed to the virus through proactive and defensive measures. As with other respiratory viruses, the WHO recommends frequent hand washing with soap and water. If soap and water aren't available, use an alcohol-based hand rub. Other precautions are to avoid touching your eyes, nose, and mouth with unwashed hands, and avoiding close contact with people who are sick. Don't share personal items such as dishes, cups, utensils, or towels with coworkers. Also, refrain from smoking and other activities that may weaken the lungs. Most importantly, either cover your cough or sneeze with a tissue, then throw the tissue in the trash, or sneeze into the inside of your elbow. Clean and disinfect frequently touched objects and surfaces. And if you are sick, stay home. Voluntary home isolation can help prevent transmission to others. Limiting face-to-face contact with others is the best way to reduce the spread of COVID-19. Social distancing, also called physical distancing, means keeping space between yourself and other people outside of your home. To practice social or physical distancing, stay at least 1 meter, 3 feet from other people. Do not gather in groups. Stay out of crowded places and avoid mass gatherings. Keeping space between yourself and others is one of the best tools we have to avoid being exposed to this virus and slow its spread. When COVID-19 is spreading in your area, limit close contact with individuals outside your household. This applies to everyone. Since people can spread the virus before they know they are sick, it's crucial to stay away from others when possible, even if you have no symptoms. Social distancing is especially important for people who are at higher risk of getting sick. If you are sick, coughing, or sneezing, wearing a face mask will help prevent the spread of the virus to others. People who are caring for you should wear a face mask if they enter your room. Masks are only effective if they're handled and worn correctly. Before putting on a mask, wash your hands with soap and water or use alcohol-based hand rub. The mask must cover your mouth and nose with no gaps between your face and the mask. Avoid touching the mask while wearing it, and if you do, wash your hands or use hand rub. A single-use mask must be replaced with a new mask as soon as it becomes damp. To remove a single-use mask, use its straps to remove it from behind, being sure not to touch the front of the mask. Always discard single-use masks in a closed bin. When using a reusable cloth face covering, at the end of the day, remove it using the straps, being careful not to touch the front of the covering. Wash it in a washing machine using hot water and detergent, then dry it completely in a clothes dryer on medium or high heat. Wash your hands with soap and water or use hand rub after removing the mask or after coming in contact with other masks. Check the WHO website frequently for updates on what respiratory protection to use and when to use it. If you do become infected, there is no specific antiviral treatment recommended for COVID-19 infection. You should receive treatment as directed from a medical professional, typically a form of care to help relieve symptoms. For severe cases, medical professionals will provide treatment to support vital organ function. If you are ill and running a fever and coughing, wash your hands frequently with soap and water or clean your hands with alcohol-based hand rub. When coughing or sneezing, use a tissue and dispose of it after use. When tissues aren't available, cough or sneeze into your flexed elbow. You will need to rest, drink plenty of fluids, and eat nutritious food. Stay home. Do not go to school or work or out in public places. If possible, stay in a separate room from your other family members. If it's not possible to separate yourself, then wear a medical mask and keep at least 1 meter away from other people. Keep your dedicated sick room well ventilated and, if possible, use a separate or dedicated bathroom. When sick, you should watch for the following emergency warning signs: trouble breathing, persistent pain or pressure in the chest, new confusion or inability to arouse, and bluish lips or face. If you develop any emergency warning signs for COVID-19, get medical attention immediately. If you need to go to the hospital and you suspect you have COVID-19, contact your emergency services and notify the operator that you have or think you might have COVID-19. If possible, put on a face mask before medical help arrives.
Caregivers should wear a medical mask when in the same room or in close contact with the ill person and should frequently clean their hands with soap and water or alcohol-based hand rub. Surfaces and frequently touched objects should be cleaned by your caregiver every day. The ill person should use dedicated cups, dishes, eating utensils, towels, and bed linens. The caregiver should wash these items with soap and water. If the ill person's condition worsens or if they have difficulty breathing, the caregiver should call the healthcare facility immediately.
For travel within and outside of your country, check travel warnings from the WHO and your country's government travel guidance. If you are planning to travel, consider your underlying health conditions, intended destination, purpose, and the expected risk. You may be more likely to get infected if you travel than if you stay home. Understanding how COVID-19 is transmitted and taking precautions to both protect yourself and prevent the spread of the disease can keep you and others safe. Visit the WHO website as well as your country's public health website for more information on what's happening in your community and make decisions based on current information.